Turning to influenza across North Carolina, we're seeing very high levels of influenza activity in our communities. During this time last year, we just started to see some positive flu tests. It wasn't really until January or February where we saw the true flu peak last year. So this year's peak has come much earlier than we typically see, much like RSV over the last couple of years. And it really speaks to the changes in human behavior during the pandemic years, including masking and social distancing, which at least for now has altered the typical seasonality of respiratory infections. In other words, respiratory infections are spreading at unusual times of the year because of these last couple of pandemic years we've had. If you've not yet gotten your flu shot and you're at risk for serious illness from the flu, you should plan to get it now. It's not too late. In addition to protecting against infection, both influenza and COVID-19 vaccines can protect people from the downstream effects of those infections, such as heart attack and stroke. People who are at high risk for complications, particularly those with diabetes or high blood pressure or heart and lung problems, are more likely to experience a heart attack or stroke in the weeks following an influenza or COVID-19 infection. Because when you get those viral infections, this leads to inflammation, which in turn can cause cardiovascular events in the weeks after that infection. So again, heart attacks and strokes. So if you want to reduce your risk of heart attack and stroke after having the flu or COVID, it's wise to be vaccinated for both of those viruses. And finally, out of concern for the health and well-being of our communities, just a reminder, we have a lot of widespread respiratory viruses in the community: flu, COVID, RSV, and some of those things occur in young children. So Novant Health, along with several other North Carolina healthcare systems, are asking that children 12 and under not visit patients in the hospital. It's common for visitor restrictions like this to take place during these respiratory virus seasons. We've done this for many years with our colleagues at other regional healthcare systems. We work together to do that to protect those patients in the hospital who are the most vulnerable.